Older can be hard, and one big change that happens is eyesight issues, specifically cataracts. June is Cataract Awareness Month, and this morning, 9 Health expert Dr. Payal Kohli is joining us to talk about it. So what is a cataract? What causes it?
So cataract, Corey, comes from the Latin term cataractus. It's actually a waterfall. So if you think about the way a waterfall is, what happens at the end of it? You get the little drops that come up that almost create a mist or a foam that you can't see through. So that's what a cataract is. It's a clouding of your lens. Now, the most common reason people get it is we get older. So we get accumulation of damage and toxins to the lens in our eye. But we can also get it from other underlying problems: smoking, sunlight exposure, diabetes, HIV. Those types of conditions can cause it radiation to the eye. And there's a rare case of neonatal or infant cataract. If mom has German measles during pregnancy, for example, the baby can be born with a clouded lens.
Are they treated? Can you treat them?
Yes, and that's the good news. So there's not a lot of medicines to treat it, because if you think about the problem is actually a mechanical problem. The lens is clouded and sort of damaged. So surgical options are what we would use. The surgery has a high success rate. It's easy, takes a few minutes to do. They just pop out the old lens and they put in usually a synthetic plastic lens into the eye instead. In some other countries, if they don't have access to the prosthesis or the plastic, then you can get a donor lens from a cadaver as well.
Is it similar to like a LASIK surgery?
It is similar. It's a little different in the sense of what you're doing. In LASIK, you're actually changing the cornea, whereas in the cataract, you're changing out the lens. But in terms of the procedure itself, it doesn't even require anesthesia.
Oh.
Yeah, and people say that it's a world of difference. So 1 out of 6 Americans over 40 has a cataract. And sometimes they don't realize it because the symptoms sneak up on you. But then when they get this new lens in, they say it's literally like somebody lifted the haze.
Wow, like the clouds have parted.
Yeah.
How do you know if it's coming on? Is it just like some cloudiness in there?
So symptoms, so you know, sometimes people just complain of trouble with night vision. That's kind of one of the earliest symptoms. You can say you have trouble with reading fine print. And you know how sometimes people just think they're getting older and they hold it farther away. But as it progresses more, it does start to feel almost foggy or cloudy, like you're looking through the glass of a shower. It gets very, very foggy, a little bit harder to see. And unfortunately, cataracts are the leading cause of blindness here in the United States.
Yeah, is there any way to prevent it?
So once you already have it, you can't do much about prevention, but really you can try to be proactive, because there's some good studies that tell us that wearing sunglasses and UV protection, for example, wearing a wide-brimmed hat, not smoking, and eating lots of fruits and vegetables and getting your vitamins, you know, through your fruits and vegetables, not necessarily those eye vitamins. I'm not a fan of those, but making sure you have a good, well-balanced diet. All of those are measures that can definitely prolong or delay the occurrence of cataracts.
We all wish we could just turn back time, right? So age doesn't play a factor, but at least there's some other things that we can do to maybe mitigate it. Dr. Kohli, thank you.